I have done quite a bit of work in the space of survivorship care. And I think it links back to my particular work focus on improving person-centeredness in our care delivery. And so if you think about survivorship, the phase of the survivorship experience in the cancer journey, it comes after active treatment is completed and before there is any reoccurrence or negative outcomes from their cancer. So it could last forever. It could last 6 months. It could last 5 years. But it's really this time in a cancer patient's life when they are done treatment and in a period of relative stable health. And we know that survivors actually have a number of late and long-term effects from having lived through cancer and its treatments. So there are some physical sequelae as well as emotional and practical impacts on their life. And so again, to the role of the nurse and person-centeredness, what we need to do is understand what is the unique needs of this individual that is in front of us, and how can we empower that individual to have the best quality of life possible through interventions, through referrals, through nursing practice, through symptom management, all of those things. And so I think that's the interface for me between patient-reported outcomes and survivorship, is that it gives us a way to really tailor our care to the needs of the patient wherever they are on that cancer trajectory. And so in survivorship, we know that cancer patients really struggle with long-term fatigue after their treatment is done. It often takes them a very long time to recuperate or to replenish their own energy banks. And so fatigue is a big issue. We know that fear of recurrence is a very big issue. Once you've had cancer and you know that there's a risk it could come back, it's really hard to keep that awareness in a part of your mental space that isn't influencing the anxiety you have to live with every single day. And so that's a huge challenge for our survivors. Returning to work is a huge challenge for our survivors, and other chronic physical symptoms as well. So, I think that's the important thing for nurses, is that we always have to be focusing on personalizing the care we deliver to the needs of the individual, whether it's in survivorship or treatment or when someone's freshly diagnosed.